Hello everyone, my name is Isabella Perotti and my presentation is about the mental health disorder borderline personality disorder. This slide introduces the concept and definition of BPD, and also I wanted to provide a brief history background. So BPD can be traced back to the 1930s and 40s. A psychiatrist named Kurt Snyder utilized the term borderline to characterize patients between neurosis and psychosis. Then later in the 60s and 70s, it was noticed that a group of patients displayed certain symptoms that didn't fit existing patterns, which led to further research and the development of borderline personality disorder. And then to kind of add to the definition on the slide, BPD causes significant distress and also challenges a person's relationships along with their emotional well-being. And those that have BPD also have coexisting conditions like anxiety disorders, eating disorders, and mood disorders. The Diagnostic and Statistical Manual of Mental Disorders is a guide used by healthcare professionals that outlines specific symptoms and criteria that a person must meet in order to be diagnosed with a particular disorder. This model defines personality disorders in terms of personality functioning and pathological traits. So for BPD specifically, an impairment in personality function is showcased by problems in at least two areas, which include identity, self-direction, or empathy. Secondly, at least 4 pathological traits must be present, and those include anxiousness, hostility, impulsivity, insecurity, or risk-taking. And at least one of those traits should be impulsivity, hostility, or risk-taking. So as you can see on the slide, there are 9 criteria for BPD, and they include unstable relationships, impulsivity like reckless driving, for example, chronic suicidal behavior, and irritability. This slide talks about the nature and nurture aspects of BPD. There is no single cause of borderline personality disorder, and the development of the disorder is complex, but it's likely caused by a combination of factors, including both biological and environmental factors, not just one specific factor. Research has shown that BPD can be inherited genetically. Additionally, neurotransmitter abnormalities may exist, including serotonin dysregulation, and serotonin is a natural chemical in the brain, so altered levels of serotonin can cause depression and aggression, which are symptoms of BPD. Research has also shown that MRI scans have linked 3 parts of the brain to either being smaller than expected or having excessive levels of activity, which ultimately contribute to BPD symptoms. I have listed the 3 parts of the brain and their functions on the slide underneath nature biological causes. And this is all relevant to a cause of BPD because studies have shown that those with BPD have differences in both brain structure and brain function. To discuss causes from a nurture aspect, BPD patients may have been a victim of emotional, physical, or sexual abuse. They may have experienced some form of distress at an early age, either abandonment or neglect, or they may have grew up around someone with a mental health condition like alcohol or drug misuse. So these all would have been factors that impacted someone with BPD at an early upbringing. The first developmental impact of BPD is physical, so that would include self-harm gestures and suicidal thoughts, along with substance abuse, for example. Cognitive impacts would be splitting, which is a term referred to as a defense mechanism in which the patient cannot form a realistic view of another person. So this person is viewed exclusively as either good or bad. So this ultimately impairs personal relationships because there's an inability to distinguish and have positive or negative attributes of another person. There's also maladaptive coping, which consists of impulsive spending, high-risk sexual behavior, binge eating, or reckless driving. Language impacts would be emotional dysregulation, leading to inappropriate or aggressive verbal responses or gestures. Social emotional impacts would be a fear of abandonment, insecurity issues, or chronic feelings of isolation and loneliness. Then lastly, there's moral/personality impacts. This would be an unstable self-image and identity, impulse behavior that may clash with societal norms, and body modifications like excessive piercings and tattoos. And these modifications can represent identity diffusion and low self-concept clarity, and it will be connected to BPD. So who is affected by BPD? Well, an estimated 1.6% of the U.S. adult population has BPD, but that number may be up to 5.9%. Women make up a majority of the diagnosis, but men could be equally affected, but are commonly misdiagnosed with PTSD or depression. Men who have BPD are more impulsive and aggressive than women and are at a higher risk of dying by suicide. An important note is that those with BPD are at a high risk of suicide and display gestures or thoughts of self-harm. Around 8 to 10% of people die of suicide that have BPD. As previously discussed, BPD is caused by genetic factors and/or adverse childhood experiences. Studies estimate that 0.7 and 2.7% of the population display symptoms arising in early adulthood, and almost all patients are above the age of 18 when they're diagnosed. There are a few treatments that are utilized for BPD to help manage symptoms. A quote that I found was that effective treatments can help people with borderline personality disorder manage their symptoms, support their well-being, and improve their daily functioning. The first form of treatment is psychotherapy. This is proved to improve psychosocial functioning, reduce severity of symptoms, and has the potential to reduce the high risk of self-harm and depression. Next is mentalization-based treatment, which helps patients regulate their emotions by increasing their ability to reflect and mentally process their feelings. Lastly is dialectical behavioral therapy, which is a highly structured form of psychological therapy. This practice combines mindfulness with emotional regulation skills and also helps patients face their distressing feelings by becoming skilled at emotional regulation, mindfulness, and interpersonal behavior. Suicide may persist if BPD symptoms are untreated or severe, or if the patient is poorly functioning. Overall, people with BPD are highly reliant on healthcare, but can be challenging to treat. Medications like serotonin reuptake inhibitors, mood stabilizers, and antipsychotic medications show limited effectiveness in controlling symptoms of BPD and are not commonly used to routinely treat BPD. Patients with BPD can be challenging to treat due to their splitting dynamics. Lastly, comorbid conditions like depression, anxiety, and substance abuse are important to consider as they complicate BPD symptoms and they can affect a patient's treatment. BPD starts to emerge during adolescence, and treatment like psychotherapy is not known to be effective due to a lack of high-quality studies. BPD is most serious in young adulthood as impulsive and dangerous behavior persists. Characteristics like impulsivity and emotional dysregulation are most common. BPD symptoms like impulsivity and suicidal thoughts and behavior in older groups tend to naturally burn out, meaning the symptoms are likely to decline over time. But feelings of anxiety and depression remain as older adults report feeling similar to younger individuals. The research study I found is called Interpersonal Trust in Borderline Personality Disorder: Insights from Clinical Practice and Research. A key takeaway is that recognizing mistrust in those that have BPD can be a turning point for alleviating some of the symptoms. Feelings of mistrust are recognized as a core factor of BPD symptoms like fear of abandonment, unstable relationships, and intense emotional reactivity. This study shows how central and imperative trust is on emotional dysregulation and how one's inability to trust can impact their disorder even further. The clinical theory highlighted in the study shows how trust is the root of BPD symptoms, and working on trust can improve interpersonal relationships and positively impact the overall progress of BPD for patients. We have reached the end, and thank you for listening to my presentation about borderline personality disorder.